Welcome everybody to the EHRA Wrap-ups. We are wrapping up the second day of the EHRA 2026 Congress live here from Paris in France. Today I'm joined by two giants from the cardiology and EP, and those are Professor Cecilia Linde, President-elect of the European Society of Cardiology. Also, I'm joined by Harry Krigis, also a legend from the EP from Maastricht University. Welcome.
Thank you.
Thank you very much.
Cecilia, can we start with the question on did the day two of the EHRA 2026 Congress live to your expectations?
Well, it was a wonderful day. It's full of very exciting sessions, practical sessions, case sessions, late-breaking trials, and a lot of networking. So I think it's the highlight of the EHRA meeting, day number 2.
Thank you. And for you, Harry?
Yeah, for me, what strikes me is that there's much more on personalized approaches. For instance, we saw the SOLVE-AF trial. They really looked into the patient before randomizing and then ablation for persistent AF. And the point is, nowadays we've got a lot more possibilities, opportunities to image patients, and that's really key to a more personalized approach. And that's what this Congress aims for.
Thank you. So they started with a session on AF in digital era. And Harry, you are in the field of EP far, far away since the digital started. And how do you look at the field of the EP right now?
Yeah, AI and EP is growing. It's a growing area. There is, in the sessions I saw there's the new thing, for instance, on AI detection using, AF detection using AI is that algorithms, they need to improve, and they are now improving, and that's really encouraging, because if you have a 20% misdiagnosis rate, which is substantial, then that may harm your studies and also treatments of patients. On the other hand, the AI detection of AF, there's also risk to it that we are detecting too much. And if you only focus on stroke prevention, then we will detect patients at low risk. And we, in my view, should more focus on prevention of heart failure in patients who eventually are being detected with AF, and also focus on diagnostic procedures which patients with newly detected AF need to prevent that they die later on during follow-up.
Thank you. And I think one of the great highlights of the day 2 was, of course, the late breakers. But some other session beside the late breakers, and it was as the trial is what also happened. And Cecilia, I would like to ask you, was there any question that you would like to ask the trialists, but nobody from the audience there to actually?
Well, there were lots of good trials in the late breaking. I think some of these trials were rather small. That is around 50 patients in each group. So what about the design of the studies? What about the endpoint? In most cases, it was AF for 30 seconds rather than AF burden. And not all of the studies had quality of life. So these are just few aspects that I would have liked to ask them.
Interesting aspects, and I do think the further studies should also take into the account all of these points that you have said. But now let's return back to the late breakers. And Harry, which late breaker was your highlight from day 2?
In fact, there were two. One is the one I already mentioned, which was SOLVE-AF, because they characterize the patient before randomization, and that enables performing personalized treatment, in this case ablation, and that turned out to be effective. And I agree, numbers are not large, but it's about a concept. It's not doing a one-size-fits-all approach. I ablate this and this, and I'm a champion in that. No, it's the concept that you first look what's there, so a diagnosis, and then you randomize, and then you see what happens. And the other trial was also novel concerning concept, that was a CPAF from China, from Shanghai, and Dr. Ling, she and her multi-center group, they show that if you focus on early persistent atrial fibrillation, you may find a striking difference performing high balloon ablation versus antiarrhythmic drugs. It's not that to say, to condemn drugs and say it should be ablation, but it's the concept of focusing on early persistent atrial fibrillation. That's a gap in our knowledge base. There are more trials coming on, like the Avant-Garde, and eventually we may end up with 2 positive trials, which then may open the way for more effective treatment for persistent AF.
Yeah, thank you. And indeed, beside the late breakers, we also had the simultaneous publication of 2 consensus documents, and one of them was the same-day discharge. And Cecilia, can you share your impression of the document?
Yes, apparently in some centers, patients have stayed overnight after ablation. AV, reentrant tachycardia, PVI, other types of ablation. And in my country, that hasn't been so usual. But there was a study about how the doctors perceived it, how the nurses and how the patients perceived not staying overnight. And the consensus was that everybody was actually happy about discharging the patient, especially the patient. And one of the possibilities there was vascular closure, because the feared complication, of course, is bleeding. And you can have different vascular closure devices that enable the patients to be able to be mobilized already after 2 hours, and that's a major breakthrough. I think that is good for the workflow, and it's good for the patients not to be hospitalized.
Indeed, yeah. I think all of us, as you said, would like that the patient be discharged as soon as possible. Harry, the other document that we had was, of course, the use of ice. And it has been discussed in the past whether should we use ice, whether is it expensive, and what would you think about this document?
Yeah, I think it's a document advocating something you cannot be against, because it's on safety for patients. On the other hand, it's expensive, at least it's seen as expensive. The paradox is that in the eastern part of Europe, it's used more than in the western part. So there's something funny going on there. In the western part, at least in my country and also in the UK, the NICE, they look at randomized evidence in this case, especially if interventions or diagnostic procedures are expensive, then the government wants to know, is this cost effective? And then you need randomized trials to support the use, and they are not there. So for ice to flow, this document is perfect, but we especially need in many countries where reimbursement is an issue, we need randomized studies.
Exactly. And in order to wrap up, now even our wrap-up needs a wrap-up, I would like to ask you, so Cecilia, what main message should a general cardiologist be actually hear from the second day of EHRA 2026 Congress?
Well, in particular today, I think it is stressed again that early intervention is better of paroxysmal atrial fibrillation before it becomes persistent, and that goes in line also with early intervention to prevent heart failure, treat heart failure. So I think early rather than late, that's one of the key messages. The other one is that artificial intelligence is there for us, but it is a possibility. But at the moment, we need to be able to read the ECG in the emergency department, and also when we check our devices, and we need to be able to program them appropriately. So we have good things ahead of us. Right now, we need to master the ECG interpretation.
Yeah, master the basic. And for you, Harry?
Yeah, for me, the Congress is It's very nice to be here, especially also that one realizes in what a wonderful world we are really living and working, because many of the communications here, they are on trying to find out why is this problem here in this patient now. And people are enthusiastic about finding out and then eventually helping people. It's a general remark, but I think we should realize that every day.
Thank you. Thank you for these wonderful messages. Thank you, Cecilia, and thank you, Harry, for joining us. And I wish you, the audience, very nice evening and very successful day 3 of EHRA 2026 Congress.